Hi, and welcome to another episode of Oral Wealth, Prosperity in Practice. I'm one of your hosts, Jackson Sadler, and I'm joined here by my co-hosts,
Brian Swilling. Nice to see everybody today. Can't talk.
Yeah, we sometimes we don't hit the ground running, but we always find our footing. It's all right. So we're happy to be here with you all again today, just with another episode of the podcast addressing a lot of the pitfalls facing professionals in the dental industry, specifically that have to do with finance and some of the other areas that we don't get extensive training in. And thankfully, we've got Brian here to help us navigate a lot of those things because I'm right here with a lot of you all, doing the best I can, learning as I go, and trying to help people avoid some of the mistakes that I and other people have made in this process. So without any further ado, I'm going to stop talking and I'm going to let Brian start reviewing a few things with us that he's observed working in the industry for the length of time that he has, with the extensive experience he has helping dental professionals navigate these things.
Yeah, thank you. Thank you, Jackson. Thank you for that intro. So just to reiterate, the purpose of this podcast is to blend financial planning, entrepreneurship, and well-being strategies tailored for dental professionals and healthcare folks. So we're here to solve an issue, as Jackson mentioned, of discrepancies that I've uncovered and Jackson has lived in the education around dental professionals and healthcare, to be more broad. So, just to go little deeper in kind of my personal experience, as I mentioned on the first podcast, my father's a dentist. My sister is a dentist. My dad just recently sold his practice. So I have grown up understanding the struggles of dentistry. And then as I decided to start my financial planning practice almost 10 years ago now, I realized that dentists would be a focus. One, I understand, and two, I knew they needed some help.
Mm-hmm.
And then into my career, I've just repeatedly talked to dentists over and over again about their financial needs, their wants, their goals, their plans. And I've just realized that most of them, even after I do my best to educate, are still struggling to comprehend some of the topics.
Sure.
Right.
So not to cut you off, but do you notice that a lot of the people that you work with have a lot of the same gaps in their knowledge? Like, do you find yourself educating people about the same things repeatedly?
Yeah. So, everybody has a little bit of different kind of knowledge base. Everybody's a Google or YouTube expert at this point. Sure. Right. But there's a lot of misinformation out there too. So absolutely. I think that, the basics, it's like what I realized is I started out earlier in my career assuming people had a base knowledge.
Sure.
And talking like I was teaching a, 201 class rather than a 101 class.
Right.
And what I realized is it's really hard to build trust and get them comfortable if I start that level, because if I start talking about that level, they think they are supposed to know this.
Yeah.
And then they're afraid to ask. And so I had to go back and what is a budget?
Right.
What is personal cash flow? What is, how does that relate to practice cash flow?
Mm-hmm.
Do you view it differently? What's the difference between different types of debt? The basics.
That reminds me of when I was in college, I had an English professor, and he used to teach us about these, we would read these old English poems, and, the language was different. So you could kind of infer what was going on by context, but his big thing was, if you don't understand something, you need to look it up.
Yeah.
So he would have dictionaries at the front of the classroom, and he pretty much would have us read through these things, and he'd ask us specifics about it. And if you couldn't answer it, he'd make you look this thing up so you understood what it really meant within the context of what you were reading. And to the point that you were making, I think a lot of people, myself included, have a habit of just glazing over things that you kind of have a cursory knowledge of. So like you were saying with budgets, it's like, well, yeah, I know what a budget is, but do I really know what a budget is? Can I really exactly? Yeah. Can I really discuss a budget with you? Can I like tell you the ins and outs and how to manage one? Like, yeah, you're absolutely right. I see that all the time.
Yeah, and I think, that's actually a good metaphor for the purpose of this podcast, right? We're that English professor. Like as we build out, as we do more and more episodes, we want to build out that, glossary of financial planning topics and talk about it, in a way that the audience can understand. So just know, for all the listeners out there, just know you're not alone not knowing. Mm-hmm. And what I tell my clients is like, I want to be their personal CFO. Like if you have a question, don't Google it. Send me a quick email. Mm-hmm. Right. And if it's more complex, then it might need a phone call, or I might not even, I still need to do research on stuff. But the difference is I can do research to refresh mm-hmm. and know that information is correct. Mm-hmm. So it's still easier for me to get the answer than it is to just look it up and go down the rabbit hole.
Perfect. So if you guys have questions, like send them in. Yeah. Make him go down the rabbit hole so you don't have to figure out what's right and what's not.
Yeah. And and tune in. So like we want this to be a place where you can take that first step if you are concerned about your financial wellness, personal finance knowledge. And we're going to relate it all to the life of dentists because, as I've seen, all my clients come out with similar issues, right? They graduate from dental school. They have student loan debt. This is the first time they've started making money. Mm-hmm. Are they going to finally buy all the nice things they wanted, or are they going to start planning, right?
Yeah.
Most of the people who just want to accelerate that lifestyle that they felt like they pushed off probably aren't going to come talk to me. They'll come talk to me when things get bad. So if anybody listening, like you can buy those nice things, but not at the detriment of starting your financial plan.
Right. An ounce of prevention is worth a pound of cure.
Yes.
If you start out early, you plan for these things so you can enjoy your life and have the things that you want without stressing about all the things that you need.
Yeah. Yeah. And that, and that's my philosophy when I talk to people. We're not all saving for that future date. It's like almost impossible to picture ourselves in the future. There was a study that showed that if you just say, hey, I have these goals, right? And this is but if it was a Harvard study. It was mm-hmm. like, how many people had goals, right? Everybody had most people had goals in their mind. And then they said, who has goals and then written them down? Mm-hmm. And the people who had written them down, so visualizing it,
yep,
were 90% more likely, or 90% of them hit. I'm killing this stat,
that's okay,
but
we'll find it.
Yeah, we'll find it and we'll put it in the show notes. But 90, those people who wrote down were much more likely to reach their goals.
Yeah.
And there was another study about showing if you showed somebody a AI generated picture of themselves mm-hmm. as an old person, like they would be much more likely to
do that,
like relate to that person. Yeah. And like if it's really hard to picture, like we're all focused on our current self. Mm-hmm. Like focusing on your future self is very hard, and that's not a dental thing. That's everybody.
It's abstract. For sure.
So we want to address all these. Whether it's behavioral finance, which is kind of how the mind works around money. Mm-hmm. We had the presentation to your dental group that you were out of town for, and that was the whole topic, right? So, we're going to bring in these topics. We're going to talk about finance. All these issues are going to be addressed. So again, write in and test our knowledge.
And what you just said actually reminded me of something. I'm very big on quotes.
Yeah.
But the planning and writing out your goals, there's a quote, I can't remember who said it, but a goal without a plan is a dream. So if you really want these things to work, you gotta put pen to paper. You actually, like, the rubber's got to meet the road at some point. It can't just be this idea of what you hope it will work out to be in the future, which is what a lot of people, I think, do.
Yeah.
They don't understand their finances. They know that every month they have enough money to pay their bills, and they're just hoping that when retirement age comes, they'll have enough money to retire. But to your point, also, it doesn't work that way.
Yeah, and it doesn't, and it's not all about, my focus is not all about retirement. It's hard to picture that person. You can't forget about that person, the future self, but you also need to have a plan to use your money for what brings you the most value,
absolutely.
Right? What you value most now. So a good plan blends enjoying yourself today, letting those memories compound. Like the earlier you get an experience, or buy something that you value, those especially those experience and those memories compound over time, just like an investment. So you can't forget to invest in your today self, but also not forgetting about your future self.
Agreed.
So that, these are the topics we're going to talk about. What about your, I know you've mentioned a little bit, but share a little bit about your perspective on kind of why you decided you would spend, your time doing a podcast about personal finance.
Yeah. I guess to summarize it, part of it is uncertainty. Obviously there's some degree of uncertainty with life in general. You don't know what's going to happen day to day, but also to the point you were just making, we have to plan for these things. So most people come up with plans, and life doesn't usually go according to plan. Like, usually, if you're lucky, the end result ends up approximating what your actual plan was, but it usually doesn't go exactly to plan. So just knowing all the moving parts that there are in the world, in our country, in dentistry specifically. I actually was just at a university, at a dental school, giving a talk going over a few things that I think are relevant to dentists who are going to graduate. For example, the American Dental Education Association, they do a survey each year of graduating seniors, and one of the things that they discuss, or actually they have a survey, and as part of that survey, they ask them about 14 different categories and their feelings of preparedness to go out and practice in those different categories. And we've got a chart that that illustrates that there are some areas where dentists feel super comfortable, things like ethics and professionalism, where like 98% of graduates feel comfortable going out into practice. But then there are other areas like ability to manage a successful business, and that number drops down to 55%, which is pretty astounding, because I think the next lowest number in that, out of those 14 categories, is about 86%. So, that just kind of shows you that there's definitely a gap there in part of our education, given that our profession historically has entailed people going out and running their own business. And also, to that point, that itself is changing. There are so many dental service organizations in the country that are either affiliating or just outright building their own practices, pretty much across the country. I think, let me reference some data here just so I'm not telling you all wrong numbers. But yeah, some of these practices, Heartland Dental Association's got over 1,700 practices. Aspen's got over 1,300. Pacific's got over 1,000. And those are just 3 DSOs. And some of the research I was doing says that there's somewhere around 300 of them, with, number of practices varying from like 5 to 10 all the way up to around 75, or these practices that have over 1,000. So you've also seen trends in ownership among dentists decreasing. I believe we'll show you this chart as well. But ownership among women was previously about 70%, down to 60%. Among men, it was around 90%. Now it's down to about 80%. And the majority of that trend, where more people are going into working with DSOs, is among people who are fresh out of dental school. So 0 to 5 years in practice. And a lot of that has to do with, from what I've seen, work-life balance, the desire not to have to deal with so many of these administrative things, navigating insurances, hiring and firing, HR, all of these different aspects of running a business that a lot of people coming out of school either have no exposure or very little exposure to. And when you talk about the amounts of debt that people have coming out of school, average over $312,000. That's not an insignificant amount of money. Yeah. And not being able to manage that debt is also associated with deferment of significant life milestones. So buying your own home, buying your own practice, if that's what's in your plans. And also, just as a side note, with the debt, the price of education is not going down.
No.
So, I mean, if you're thinking about, again, that future self, if you're thinking about your life 20, 30 years into the future, you're thinking about if you have children, or you're thinking about having children and you want them to have some of the same opportunities that you've had, then you have to plan financially. Otherwise, you're relegating your kids to a life in debt. Because if we're paying $312,000 now and the trend is only going up, what can we expect our kids to be liable to pay for? And if the salaries or the income is not increasing significantly, then that may not be an option for them, or it may not be the financially sound option that it is for us currently.
Yeah.
So just a lot of moving parts, and beyond that, awareness about things like what's going on politically, that affects the field of dentistry. Because I think sometimes we get out of school and we get wrapped up in practice and our lives, and we don't pay as much attention to what's going on within organized dentistry and dentistry as a whole across the country. And there are some significant changes being made.
Yeah.
The CDC just closed their oral health division. So, they provided a lot of data and research for the dental field that may be more difficult to obtain, which is going to make it more difficult for us to determine the direction that dentistry needs to be taking and how we can best serve our patients and the community in general. And, even things like the proposed Medicaid cuts.
Yeah.
That's going to create there's already a significant number or percentage of people who don't get dental treatment that they need. I actually saw a study, I think it was done by the ADA as well, that highlighted the fact that somewhere around, actually this was a Kaiser study, but somewhere around like 30% of people, insured people, it's like 28% or 30% of insured people have gone without dental care that they needed within the last 12 months because of cost.
Yeah.
And that's insured people. And if you think about uninsured people as well, you think about the fact that the amounts of debt that people have coming out of school typically deters them from going into working in public health settings. There's already a huge need within dentistry for access to care.
Yep.
For a large subset of the population. And that's probably just going to become exacerbated. So how do we navigate, managing our patients, doing what they need and what we feel is going to be in their best interest, when there's limited access to care. That access is going to become even more limited and cost prohibitive. And beyond that, we have to keep the lights on if we're going to keep helping people.
Yeah. And that's a really good point. And it reminds me, actually, at your dental society, one of the dentists brought up the fact that there's a bill going into the North Carolina Senate that on paper looks like it's going to give access to more DSOs. So there's this pull and tug against the individual dentist, the single practice or, couple practice dentist that wants to do the right thing versus these corporations coming in and having free access. Right.
Mm-hmm.
But all those, all these things, these, stresses or these tug of wars in dentistry between insurance and DSOs and student loan debt. I've seen trends like you mentioned on Medicaid, right? Like it's hard to be profitable in that space.
Right. Very.
So even if you do have Medicaid, you're insured, finding a dentist that has availability
right
near you is going to be harder. And even that private practice that, takes private insurance, I've seen profits, their take home go down. So these struggles are real, and I'm seeing it in real time.
Yeah. And actually that reminds me of another point. There's another study put out by the ADA saying that there's going to be a deficit in the number of dentists. I can't remember the exact year, but I want to say it was maybe 2029 or early 2030s. If the trend continues, there's going to be a deficit of needed dentists within the country. There's going to be about 12,000 fewer than we need. And hygienists, there's going to be about 20,000, I think, 23,000 fewer than we need. So from a hiring perspective, trying to get those employees into your office in terms of hygienists, or if you're a provider, trying to, if you're not going to open your own practice, which we've kind of outlined some of the difficulties that you face there. If you're going to go work with a DSO, to the point you were making before, you sometimes have to navigate and balance this profitability versus patient care.
Yep.
Because we should always be primarily concerned with the best thing for our patients. When I was going through training, one of the things I was told, and just throughout life, if you do the right things to try to help people, then you don't have to worry about the money so much. The money will come in, but there's still that tug of war with things, and it's a thing that you have to navigate daily, and there's burnout associated with that, just like there's burnout associated with any stressful thing you got to navigate.
Yeah, I mean, and that's kind of leads to kind of some of the things we're gonna discuss on this podcast, right? Like, what are the biggest financial misconceptions among dentists? Why do so many dentists? We don't have to answer this question, but these are questions we will answer. Like, why do so many dentists struggle with money despite the high income? Mm-hmm. Right. And some dentists are like we're talking about, some like I started a practice and I can't even pay myself. Right. Yeah. My hygienists are asking for too much money. And then, how can dentists effectively balance that their professional and personal lives and that tug of war within dentistry that's happening? So we want to give, this podcast will give everybody, the basic tools they need to make that decision. And, private practice is not right for everybody. DSO world, if you understand what you're getting into, which will, cover contracts in the next episode. So you need to know what you're getting into, but we would like everybody, biasly, a practice owner, I can help much better than I can, individual dentist working at a DSO. Mm-hmm. But it doesn't fit for everybody, but we'll give you the tools to make those decisions.
Right. Absolutely. And also people's careers will change over time, Yeah. But that was one of the other things, some good advice I got, when I was coming out of residency. Most people's first job is not their last job. Which at least for myself, I felt a fair amount of pressure getting out, trying to make sure I was making the right decision. And it reminds me of a quote, another quote. Dr. Maya Angelou, she said, do the best you can until you know better. Then once you know better, do better. And that's how I've been looking at a lot of this.
Yeah.
You make the best decision that you can make for yourself in the moment with the information that you have. And then if you learn new information or circumstances change, you pivot. You just do the best you can. So that's really essentially if we're going to summarize, if we're going to wrap up what this is about, we want to help. We want to help you learn those things you don't know so that you can do better, so that we can all do better, so we can advocate for ourselves as practitioners, as employees, as business owners, and so that we can make sure that we keep the focus where it should be, providing the best care for patients that we can. So we don't have to deal with all of these or at least worry so much about these financial stressors that can unfortunately influence some of the practice decisions that people end up making.
Yeah. And that's the number one stressor for most people in business. So your employees and the dentists themselves is financial.
Yep.
If you have that financial stress, you never show up with the full self.
Yeah.
You can't treat your patients with the best care. And that ends up making bad decisions. Like you end up selling your practice because you can't, you feel like you can't make enough money, staff turnover because they're stressed.
You end up doing 14 pulpotomies on a kid in one setting.
Yeah.
That's from an actual study that I saw recently.
Yeah. I'm not sure. You're going to have to explain what a pulpotomy is, but
the 14 of them is entirely too many to be doing on anybody, especially in one sitting.
Yeah. I will admit, I know a lot about dentistry. I do not know what that is.
That's fair.
So as we wrap up again, like we are, to reiterate what Jackson said, we're empowering dental professionals to achieve, financial well-being, business success, and personal well-being also, right? Because again, the core, if you have your money right, you can do the things you want to do. To
focus on other stuff.
Yeah, focus on what brings you joy and brings you fulfillment. So please, everybody, if you're listening, well, you are listening. For all the listeners out there, please write in questions, concerns, topics you want to discuss. Submit those questions. We'll cover all those things in time. But if it's top of your mind, like again, contract negotiation, it's top of mind right now for Jackson. So we're going to do an episode next on that. So we're educating ourselves as a topic comes up. As I see reoccurring themes, we might accelerate that topic because it's top of mind and important at the moment. So again, thank you for listening today. Tune in for future episodes. Make sure you check the links in the show notes for some references we made. Like
and subscribe.
Yeah, like and subscribe on wherever you listen to podcasts. And continue to tune in, share the episodes with friends if you find them valuable. But we just want to say thank you, and we'll see you again soon.
Yeah, we'll see you next time. Take care of yourselves.